Yeah, so first off, I'd like to introduce myself. I'm Rob Anderson. I'm a practicing anesthesiologist in Richmond, Virginia. I'm also the physician co-founder of Marit Health. Marit Health is really working to bring salary transparency and a modern job platform to medicine, which has been sorely lacking. Currently, now 80% of clinicians are employed and have really no insight into the numbers, and we are trying to expose those numbers and allow people to negotiate from a place of strength. Um, the reason that I wanted to build Merit Health is threefold, really. I've been an applicant before. I have looked for jobs. I know where the information is lacking. It's especially lacking now as we are all or majority employed and have no insight into the numbers. On top of that, the second reason is that I've been involved in the recruiting space. I've been in leadership throughout my career. I've been the lead recruiter for our group, and I have seen the challenges on the recruiting side, and I've also seen the deficiencies on the applicants where they don't negotiate, they accept their first offer, and we kind of get to an agreement pretty quickly. And a lot of people leave money on the table at that point in time. The third reason really is that I have seen firsthand what salary transparency does to other industries. My co-founder and twin brother was early on in Glassdoor and helped build Glassdoor, which brought salary transparency to the tech space. And we've had conversations over the years talking about why this didn't work for medicine. Medicine is this black box. It's just the language is different, the system is different, it's kind of sheltered. And we wanted to bring that same glass door experience to medicine and bring salary transparency to medicine. In terms of what I have seen as a lead recruiter for my group, most physicians, especially most residents coming out of training, accept the first offer. If anything comes out of this conversation, what I want to encourage residents and early stage clinicians to do is negotiate. The first offer is really the starting point. In the business world, and I've seen this now as I've entered into this merit world, the first offer is the starting point. It leads to other negotiations where in medicine, it's just oftentimes the end point. And I want to encourage people to push on that. I think we've been through our medical training, whether it be through medical school, whether it be through residency, we've been taught to accept the crumbs that we've been given. We've almost been beaten into submission. Just accept this. And no longer do you have to do that. You are, people coming out of residency, you are a full-fledged attending now, and you have value within the health system. And I think I want to encourage our clinicians to negotiate a little bit more from a position of strength. If you were to negotiate, really, you have to come to a negotiation with data. You cannot come with hunches. You cannot come with instinct. You cannot come with anything other than data, because on the other side is the administrator or the health system that has a team that is working to aggregate data across multiple sources, including MGMA, AMGA, other blended sources, to create a strategy to benchmark your salary. And so you are coming in with very little, going against a behemoth that has years of experience and reams of data. And so we want to try to level that playing field by giving the clinician some data as well. So the data that we have found that health systems are currently using are large, legacy benchmark data sets. The primary one is MGMA. That is a large data set of over 200,000 clinicians aggregated from large health systems and large employers. And that is kind of the legacy benchmark. There are other data sources, AMGA, Sullivan Cotter, other legacy benchmarks that are in the business of gathering data sets. All of them come with their own strengths and weaknesses. and deficiencies. And so oftentimes, as we talk to health systems, they use an aggregate of multiple sources. And so they are basically gathering multiple data sources and creating a blended unit or a blended analysis. These legacy benchmarks are oftentimes created by employers for the use of employers. And so if you're a large employer and you contribute your employees' data, you gain access to that data set. As a clinician, for you to access that MGMA data set, you would oftentimes have to pay over $800, okay? And so fortunately for us, as Marit, who believes in salary transparency and his main mission is to expose this data, we have partnered with MGMA. And so we provide MGMA data for free as long as you're a user and contribute a salary on Marit. So Marit is unique. Marit is unique. We have 27,000 anonymous salaries of clinicians across the country. We work on a give to get model similar to Glassdoor, where as a practicing clinician, you contribute your salary, you expose all the other salaries in the database for your specialties and others. And we go deep into individual salaries. And so you don't just get to see the averages, you get to see individual salaries within a specific metro area. If you want to drill down to that, you can see all the data, including the salary, the bonuses, the hours, the vacation, the benefits that make up that salary. And so you can see what your worth is, what the workload is for that salary. So Merit is a anonymous salary benchmarking tool. And to gain access to the data, it's as simple as just contributing your own salary information. It's a 2-minute survey. It goes through your employment type, your hours, your benefits, your call structure, et cetera. And it's done in 2 minutes. And once you do that, you unlock the 27,000 salaries data points in our database, as well as MGMA data and AMGA data. And so 2 minutes gives you the entire data set that employers are currently using to negotiate against you. And that's why it's so important to create an account with us and join the mission of democratizing this data. Yeah, the biggest piece of advice I would give for any physician about to negotiate a salary is just to come with data, right? So gather as much data as you can, whether it be Merit data, whether it be MGMA, AMGA, and bring that data to the forefront, okay? No one is going to accept a hunch or an intuition about, well, this is what I'm worth. That's just not a feasible explanation in a data-centric world that we live in now. The second thing I would encourage, especially new residents coming out that are interviewing potentially multiple locations, is to come with multiple offers. If you have multiple offers, the cards are in your favor, right? They are now fighting for you. And so that allows you to negotiate even stronger with the numbers from a position of strength because you have options.